I wanted to do a quick video just to tell you what chemotherapy is. I think there's quite a mixed understanding of what chemotherapy, radiotherapy treatments are. So chemotherapy is a combination of words, which is chemical therapy, and radiotherapy is a combination of radiation and therapy. So just to focus on the chemotherapy or chemical therapy is a combination of drugs, often in liquid form. So it's generally a bag of liquid, which is a mixture of different drugs, which is given to essentially poison your whole system, which is why chemotherapy is given when people have disease that's spread, because it means that the chemotherapy can work throughout the body. So it goes around all of your veins, gets into all of your tissue. That's why they put it into the veins, so that it can get to every element of your body, which is why it has such a toxic effect, because it affects every dividing cell. Often that's why people lose hair, because your hair is a rapidly dividing cell, because obviously our hair and our nails grow on quite a fast basis. We obviously don't produce other bits of our body in the same way. Obviously, we don't produce bone in the same way as hair. So your hair is more likely to be affected by chemotherapy. And it's given on a cycle, so that the cycle can keep entering the system and giving your body just enough time to recover, so that it's not too poisonous, but poisonous enough that it's relentless to interfere with the tumours. So that's kind of a rough summary of what chemotherapy is. So it's drugs, and it can be in tablet form, so it's very similar to taking antibiotics, for example. You can take antibiotics and it has a different impact. And that's why when I sit there with the chemotherapy attached to a tube which goes into my chest and into a vein, that's a bag of drugs which then gets into the system and takes a while to work. So obviously there are some immediate effects, and then there are some longer term effects, but ultimately they're cyclical. So that's the basis of chemotherapy. And there are lots of different types of chemotherapy, and I have had different types. And in the past, I've had chemotherapy that is infused over 4 to 5 days, so I have to stay in hospital. Whereas the chemotherapy I'm having at the moment, I have 2 bags and they take about half an hour each. So very different setup. And you can also have chemotherapy in tablets, which you take at home, which again is no different in potency. It's still as toxic. It's just a different way of administering it into the body. And I'm assuming over time that they have figured out that some drugs are better given in tablet form and some are better given in the liquid intravenous form. If you have any questions, just let me know. I will try and answer them. Just put it in the comment section below and I will answer them, because I know even now people who are in my life and have been for a long time still find it a bit confusing, and I still find it confusing at times, but I'm happy to find out the answer. Obviously, I'm there all the time. So, yeah, just let me know if there's anything that you don't understand. I can try and answer it. Okay, bye.